Thank you, Pam, and thanks to the entire team here at the Indiana State Department of Health for joining us today. I'm also especially grateful to be able to introduce people in the health community all across the state of Indiana to our newly appointed commissioner of the Indiana State Department of Health, Dr. Jerome Adams. Dr. Adams joins us from Eskenazi Health. He's a member of the executive committee here at the Indiana State Department of Health, and he'll be starting his new position in the next couple of weeks. Like all of you, he joins us today to talk about how we can work together to focus on what I believe is the top priority of this administration, to see to the health, safety, and well-being of Hoosiers, in this case, in dealing with the latest emerging disease in this country, Ebola. First, let me say on behalf of all the families of Indiana, to the physicians, to healthcare providers, to the staffs in hospitals and facilities all across this state, thank you. Thank you for all you do for Hoosiers each and every day. And thank you for joining us today to continue to learn and to prepare. Like all of you, the First Lady and I were saddened to hear the news from Texas yesterday that the patient who was ill with Ebola has passed away. As our state and local health officials demonstrated in the successful handling of the first MERS case on American soil at Community Hospital in Munster, let me say with great confidence, in consultation with our team here at the State Department of Health, great confidence in each and every one of you, Indiana is ready. I believe our state is prepared to effectively respond to the threat of Ebola should a case occur here in the state of Indiana. Our State Department of Health will continue to work with the CDC, with partners around the country, and most especially with all of you, our local healthcare providers, as we prepare for the potential of the emergence of this disease in our state. You are the first line of defense in any emerging disease, and you are the first line of defense in the potential emergence of the Ebola virus in Indiana. Let me say, first and foremost, we have no reported cases of the Ebola virus in the state of Indiana. However, there's no doubt that the Ebola virus has been a cause of national and international concern. It's a growing concern across our state as well. In Indiana, as I mentioned, we have successfully managed emerging diseases before, most recently the H1N1 Pandemic Flu in 2009, and of course, as I mentioned, the first case of Middle East Respiratory Syndrome earlier this year. Let me say with confidence, the professionalism, dedication, and medical expertise demonstrated by each and every one of you and our team here at the Indiana State Department of Health, our public health and healthcare community during these and other outbreaks gives me and the people of our state confidence that we are prepared to effectively respond to Ebola should it emerge in our state. The Indiana State Department of Health has been working closely with the Centers for Disease Control and Prevention and other states to track and prepare for Ebola virus. Lessons from Texas and Nebraska are being learned and shared as they occur. The State Department of Health will continue to stay in constant contact with each one of you as new information and guidance becomes available. Information is also regularly being updated on the State Health Department website as this situation develops. A few closing thoughts as I turn it back over to the experts and to an important part of our ongoing dialogue with each one of you. As CDC Director Dr. Tom Frieden has stated, it's important to remember the enemy here is not a person or people, it's a virus. Based on our past experiences and my knowledge of the compassionate and competent people of our state, I know that if Ebola emerges into Indiana, we will, all of us, do everything in our power to contain the spread of the illness and communicate the situation in real time with Hoosiers. That's our pledge to each and every one of you. As healthcare providers, once again, I want you to know that our administration recognizes that you're on the front lines of this and other battles with infectious diseases. My pledge to you as your governor is we will continue to work with each one of you to prepare to face the challenges posed by managing and treating any emergency disease, including Ebola. We have some important information here for you today. I hope you'll stay for the entire webcast and ask questions at the end. And again, let me say, we have no higher priority in our administration than the health, well-being, and safety of the people of Indiana. You are the first line of defense in that cause. I want to assure you we will continue to work with each one of you to provide the resources and the information to see to the best interest and well-being and health of our people. With that, I'll turn it back over to our state epidemiologist, Pam Pontonis, to continue. Thank you all.